Can newborn genetic screening results be false positives? Have you ever wondered if the results from newborn genetic screening can sometimes be incorrect? This is an important question for new parents. Newborn genetic screening is designed to identify certain inherited conditions early on. However, it is possible for these tests to produce false positives. A false positive means that the test suggests a newborn may have a genetic condition when they actually do not. Newborn screening tests check for various metabolic, endocrine, and genetic disorders. These tests often use biochemical markers or genetic sequencing to make their assessments. While these tests are very sensitive and can catch most true cases, they are not perfect. This imperfection can lead to false positives. The rate of false positives can vary based on the specific test and the condition being screened. In the United States, the average false positive rate is around 0.5%. However, for certain conditions, this rate can be much higher. For instance, some studies indicate that for every true positive case found, there might be dozens or even hundreds of false positives, particularly with conditions like galactosemia or congenital adrenal hyperplasia. This means many families may receive a positive result only to find out later that it was incorrect. Receiving a false positive can be stressful for parents. It can lead to unnecessary worry, additional hospital visits, and extra tests that may not be needed. This situation can create what some call vulnerable baby syndrome, where parents become overly anxious about their child's health due to initial screening results. To help reduce the occurrence of false positives, some programs are implementing second-tier tests. These tests provide more specific biochemical or genetic analyses. Advanced data interpretation tools are also being used to consider multiple markers at once. Some laboratories have developed refined algorithms and collaborative data sharing to improve accuracy and lower false positive rates. New technologies, such as genome sequencing-based newborn screening, are showing promise in reducing false positives even further. In clinical studies, these methods have demonstrated no false positives while identifying more true positive cases compared to traditional screening methods. While newborn genetic screening is a powerful tool for early detection of hereditary conditions, false positives can happen. Continuous improvements in testing methods and data interpretation are helping to minimize these occurrences. Families receiving a positive newborn screening result should follow up with confirmatory testing and genetic counseling. This will help clarify the diagnosis and understand what it means for their child's health.